these trainings, basically because it allows us to talk freely without having to write down every single moment and remembering, what did he say? What was that? Did he say up or down? The whole thing's going to be recorded, so that way if there's questions, what did we talk about, you're going to have the video and the audio to this, and each one we do in the future. It's just so beneficial to take advantage of the technology that we have, so we use it and we're recording it. So thank you guys for joining us. I'm glad we're going to be able to sort of dive right into pulse magnetic therapy as much as we can. I sort of go into this and I assume sort of nobody knows nothing. So if I'm saying basic things like, yeah, we get that water is wet, Josh, don't take it personal. I just assume nobody knows nothing. I start, if you will, from the basics of 101. That way I know it's all been covered. So if I'm talking about something that you've already sort of discovered or learned on your own, feel free to jump in, say, yep, we got it, we know that and all that, because obviously the goal is to maximize the benefit for you guys, specifically for what you're using it for. This is what I figured that we're going to do today for the short period of time. I'm going to just, in a second here, I'm going to stop talking, and I just want to hear what you guys have to say so far, what you've tried, what you haven't tried, any feedback, good, bad, or otherwise, the whole nine. And then we're going to dive into two things, is how to convert, how to do the demo, if you will, how to introduce it to all the patients so they get an experience and convert them over to paying patients. And we're going to talk about protocols, how you use it to get successful results right away. As simple as that. We can always get back together a little bit later and do a history lesson and talk about the science and all of those cool things. But for the time being, I think it's probably better use of your time and our time to get you guys comfortable using the machine and all of that. We can always do the science and information stuff behind it. That you won't need that as much as you will how to operate the device properly with the patients. So let me just turn it over to you guys for a little bit. How has it gone so far? Good, bad, terrible, anything in between? Problems?
I would say it's kind of like, I would say uneventful. It's like we've had one lady on it. She had a knee replacement that failed miserably, and she might be looking at, who knows. But she had low back pain, ankle pain, and the low back pain seems to be responding with the machine. She's been long-term, so it's kind of hard to tell. She's been up and down, so I'm always leery of what she says, but the knee doesn't seem to respond at all, really. I've had another guy that he has a degenerated hip, but he has motion in the hip, and he's a machinist, and he's standing a long period of time. And we've been using it on him, and he's not sure. It doesn't seem like it pumped up the results at all. We were treating him before. He was coming, we've noticed he was a stubborn case. We started using the EMF on him, and right now it seems like I see positive things and showing him in the range of motion, but pain-wise, it seems like it's he's not sure. He can't give me a definitive answer.
That's good.
That's really about it right now. Yep.
Okay, that's good. It gives us a baseline.
An older lady, and she seems to be getting good results with it.
Okay.
She's had this problem, SI joint pain, leg pain. It comes and goes through the year. I'll see her, then I'll see her again, then I'll see her. So I decided to see what this could do, and she feels she's getting positive results there. And after that, I don't know if it's going to be, like I said, that's good, but I'm not sure. It's kind of been intermittent problems, so it wasn't like a wow factor, but we do think, based on her feedback and what I see, it seems like it's doing the trick. So I can't say that there's like this great response. I see some positive things, and like I said, hopefully with this, I'll do some things a little differently, and we'll see where we get with that.
Yep. That That's really what this is for, is to get the okay, yeah, we're seeing something, to turn those into, holy crap, what did you just do to me? You just fixed me in 10 minutes. That's
Right.
essentially what the goal of this is to do.
Well, that's what I'm.
So this is what I want.
Gosh.
Awesome. We're on the same page. And also, I'm via email as opposed to doing it this way. I'm going to give you my mobile number. So if you have questions that come up when you're with a patient, if you have a protocol question, hey, Mary just came in. This is her first time, and she just had a hip replacement. And how do we do it? Send me a text. I'll be able to get you the information right away as we're going along here. Here's what we're going to do. Okay, I'm going to sort of split this in half, and we're going to do really, if you will, the left half of the brain and the right half of the brain, because what we talk about here are two totally different things. The protocols for successful treatment with this machine, as an example, the machinist that you're talking about, the protocol for him, the way we use it, is going to be completely different than when we demo a patient to sort of get them in the office to try the machine out. Okay, it's two totally different concepts. So I'm going to move away from this screen here, the practitioner's office, and I just want to start with the protocols, because you guys have started in with the machine. You guys are already using it, and if you will, you're a little bit ahead of the game. So it's better for us to start with the protocols first. Okay. Mm-hmm. So I'm gonna give you one quick answer and then a little bit longer answer. Okay, what I'm about to give you is the protocol for 90% of all of the conditions with the machine. Okay. This technology, and we're not going to do the science or the history, but this technology, more than anything, is body part specific, not pathology or condition specific. Okay, and a really good example is autism, bipolar, post-stroke, Parkinson's, and Alzheimer's are all the exact same protocol with our machine. Okay, it's because of what we're trying to do with the machine, not the pathology or anything else related to it. We're trying to restore the electrical communication on both halves of the brain, and that is a big factor in all those different issues. So that's sort of how we utilize the machine. Okay. And with that, this protocol that we use that I'm about to give you, it's effective literally for 90% of the conditions. Everybody, as you know, is different, so we fine-tune and we tweak and all that. And the one thing that I want to tell you before we go any further is, no matter what we talk about today, no matter what we learn today, the most important thing is your training and your intuition. You, Dr. Gary. Because we may talk about sciatic injury, and I'll give you the protocol and say, hey, this is what we used with the Dodgers and the Cubs yesterday, and it works great. But it doesn't work for your patient, because you know your patient had also an accident a few years prior, and they have an impinged left shoulder, and you think it's the left shoulder that is really the problem, and the hip is just secondary. So go with what your gut says. Does that make sense? What I'm saying?
Yes, it does.
It's sort of giving you permission to go away with what go off of the paper, because you're going to know your patients, and your intuition is it's invaluable. It's something that we can't train for, and just about every time we get a plateau in a condition. Hey, fibromyalgia patient, 30 sessions, they were doing great, and now we've had, they were doing great after 15, and they haven't had a single result after the 16th session. Go with what you think it is, as opposed to necessarily what I'm going to tell you, because you're going to know something about the person versus me. So having said that, here's how we use the electromagnetic field therapy in a general form. Okay, if I was trapped in an elevator with you and you said, how do I treat this condition? I would tell you this. We treat position 1, 2, 3 and box the area. And when I say box the area, I mean as many walls as possible come from as many angles. We're going to expand on this concept. That's what these next few pages are. But that's the elevator, if you will, the elevator answer. We put position 1, 2, and 3 and box the area. And the reason being is very simple. If electromagnetic field therapy does what it says it does, and it energizes the cells and works systemically, and it empowers the immune system and oxygen and all these things that you read about, then it has to be that the systems of the body need to be enhanced to facilitate the healing. The broken toe doesn't heal the broken toe. It is the systems of the body working collectively in order to do so. And so we have found that you put the loop on, let's say, a bad knee for 10 minutes, and that is less effective than moving the loop around in certain strategic or targeted positions. We have found it to be more effective. Okay? So for everybody that uses the machine, Joe with his broken toe, Mary with fibromyalgia, Fred with hernia, Jason that has a rotator cuff injury. When they walk in, the first thing that we do is we do position 1 for the heart, for the lungs, for the thymus. You can see the picture of the football player and the basketball player. There's Shaq and there's Igor. We turn the machine on, we let it pulse, and we have them bring it into their chest until they feel it. And you know and I know this is one of those things you can feel. So we want them to bring it to their chest until they're comfortable, but without being uncomfortable. Okay? Some people put it flush on their chest and they have no problem and they don't mind their chest jumping. Some people, it's a little bit much and we back it off. That electromagnetic field comes off of the loop of the machine that you have about 4 feet on both sides. Okay? So if we have it a foot away or half a foot away from Mary's chest, there's not a concern of, are we getting a treatment? It's not like a laser where it's centimeters. We're getting a strong enough field even if they're not feeling it that much, okay? So it's totally based on user comfort, okay? Each spot that we talk about, that we're going to talk about going forward, we want to treat 2 to 3 minutes. And how we determine the length of time is 2 basic factors: the size of the person and how many times they've used the machine. Okay, so the 2 extreme examples that I give out is when my 96-year-old grandmother uses the machine the first time, I give her 2-minute spots sessions, 2 minutes on each spot. When I use it with Shaquille O'Neal, 7'1", 325 pounds, he gets 3-minute spots. He's bigger, he has more mass, okay? So most people, we want to start off with 2 minutes, and then we work our way up to 3 minutes, because as you'll find, once they start getting 2 to 3 minutes on a spot, they're going to detox a little bit, they're going to get results. We don't want to do it too much too fast, okay?
Okay.
So we'll do position 1. They come in, we're going to do their chest for 2 minutes, and then we're going to do position 2, we do the crown. And you can see this is a swimmer right here, where he has the coil placed. That field, again, is very strong. So, personal example, that's too close for me, Gary. That I can't deal with that. That's too strong on the crown of the head. For me personally, I've had a lot of dental work, and I feel it thumping in my teeth. Okay? My wife she's very lucky. She had 1 filling her whole life. So she can put that all the way down to her chest, back and forth, and sort of laugh at me like, what do you mean it hurts your head? It doesn't hurt me, to make fun of me because I've bought my dentist a Porsche, basically. So it's comfort, okay? But we do want to get a treatment field on there where people are going to feel it. And most people are going to feel it in one of 2 areas: wherever they've had dental work, me, or wherever they have sinus or tension headaches, other people. Okay, so somebody will start to bring it to the crown of their head and they're going to go, wow, that's so weird. This is the spot where I get my migraines. I feel it like ticking in there. Or, okay, we want them to experience a sensation like that. Okay, so we'll do that spot, chest, crown, and then we flip them over, if you will, like a pancake. They can sit up. It's based on comfort of sitting. And we put it in the mid-thoracic. We do below the shoulder blades, but above the tailbone. We're really looking to go over the kidneys, the backside of the liver. Most people will say that it feels like electric hiccups. It's a real good way to explain it, because their rib cage is jumping up and down. It doesn't hurt. It's just they're jumping or tickling or giggling. Okay? The reason that we do these 3 positions, the chest, the crown, and the mid-back, is we are energizing the systems of the body. Okay, these are the 3 main systems of the body that are going to do the work. And if you believe in Eastern medicine at all, this is the way that energy flows through the body. So this protocol was developed by a gentleman who used the first versions of these machines in 95, 96, 97, and 98, doing clinical trials in the Philippines for the government. They basically gave him a wing in the hospital, and each week would send different cases down, and they would just use a Ford Model T version of this machine. And that's how this protocol came about, was trial and error. Okay. The last area, when we go to box area of need, is we want to come from multiple angles on the key spot, on the hot spot, on the reason they're coming to see you. Okay. Was it the machinist? Did you say he had a hip? Was it his hip issue?
Hip. Mm-hmm.
Okay. Yeah. So I'm going to use him as the example, even though we have shoulder and stuff here. So the machinist, we would do chest, crown, mid, back, all at 2 minutes, which is 2, 4, 6 minutes a session. And then we would do his hip, and we would increase the time a little bit. We'd go to 3 minutes on a spot. And this is the key. We want to do anterior, posterior, and to the side. Okay? I've got a couple pictures, and I'm going to email this manual to you as well. When we box an area, we want to be able to come. There you go, right there. So there's the hip. We want to be able to bring that loop right to the front of the hip. And if he is not feeling it in his hip, we don't have the loop in the right position. We just want to sort of move it around that area a little bit closer to the groin, a little bit away till they go, oh, whoa, there it is. And they're going to let you know that's their spot. Okay? We do there. We do the back side. Even if the pain's in the front, we do the back side closest to the spine. Okay? And then we either do to the side or we do leg through the loop. Okay? Leg through the loop I have found to be a fantastic way to basically treat the psoas, the adductors, the hip socket, the labrum, the groin, the hamstrings. Even, believe it or not, that position is awesome for the sciatic nerve, because when you have your leg through the loop and then you sit down, you feel the pulse go up the sciatic as opposed to normally when you have sciatic pain and it goes down. So it's boxing that area. And here's the reason why. We know scientifically that magnetic fields work best at angles. Right, that's why MRI machines, all magnetic resonance imaging, all magnetic machines are circular. You go inside them because they want to put you in the center of the magnetic field. That's the goal. So by doing this, by boxing an area, we are taking that sweet spot, that nexus, and we are moving it around to different key areas. Okay, I've got a couple cool experiments for you guys to try and play with, and this is one that sort of makes you go, oh, okay. When you take the loop and you treat your face, okay. Let's say, for example, my left jaw was hurting. If I put the loop over my left jaw, it shakes my head and it bounces me around and it moves, but I don't feel it in my jaw. When I take the loop and I put it on the right side, where do you think I feel it?
Left jaw?
Yep, right to the spot. Comes right across.
It does.
And I put it the opposite side. Yeah, it goes right across. And you're like, what the hell is that? Wait a minute, the pain's on the other side. Does it know where to go? It's because we seem to be hitting it at that right angle, at that proper magnetic field angle. Okay? So that's why I said you play with it for yourself, because you'll feel these different sensations. I have one guy that had nerve damage from a car accident, and he has foot pain. So he doesn't feel the machine at all when I put it in his foot. But when I put it on his right hip, his foot pulses and tingles. And that's the only place he feels it. I have to be all the way away at the starting point of the nerve, and that's where he feels it.
Okay.
So, and obviously the reason I'm telling you this is because everybody is different, and somebody's going to say, "Oh, that's you've put it on your shoulder a million times, and you feel it," and Fred comes in and doesn't feel it on his shoulder, and you go, "Why?" So I know especially doing what you do, that the body is cross-connected. So the other thing to put in your back pocket is when you run into a plateau. And I'm going to go back to the 1, 2, 3 box the area in a second. But when you run into a plateau, you've done 1, 2, 3, you've boxed the area, machinist's hip has gotten 50% better, but now it's been a month and it's not any better, right? We got to that 50% better, but now he's plateaued. That's now the time where we go to the opposite side. Now we're going to go to the left side. We do the same thing that we're doing, but we're going to box his left hip.
So
we're going to do the opposite side of the injury. Yeah.
Okay. Will he feel it on the opposite, on the where the pain is? Like you were saying, in the jaw, you go to the opposite side, you feel it in the jaw. You go to the left side, you feel it in the right side. Will he, when you go to that, at the right hip pain, you go to the left hip, will he feel it in the right hip, or is it just going to be felt in the left hip? Or both? What
he's going to feel, I will tell you almost verbatim what he's going to tell you when you try it on his left hip. He's going to jump back and look at you and go, "What the hell? What are you doing?" And forgive the language. He's going to jump back because he's going to feel it far more acute on the left side and far less penetrating, because he has compensated over the years for that right hip pain for so long that he's creating a different issue on the left. So that's how you'll be able to also know, okay, this is doing something, because he's going to tell you two distinct sensations on one side versus the other. The right's going to feel
Okay.
like a deep, like it's pulsing into my soul. I hear that a lot, like it's in the core of the issue of the hip. The left, he won't be able to get the loop as close. It's going to be a more acute pain. And he's going to say, "Wow, I didn't even realize there was pain there." And that is typically
Okay.
because the volume of the right hip pain is so pronounced for so long that the body doesn't even recognize something that's insignificant. I'm going to give you one other quick story that will connect here. I get this a lot in baseball versus any other sport. There's this kinetic chain where if one area goes down, some other area goes down in the body later on. They see this a lot, and that's how they're trying to do all this preventative stuff. So I see this a lot with pitchers, right? I will get a pitcher that has a sore left knee, a right-handed pitcher that has a sore left knee from pitching all season long, right? That hip rotation, that planting on their left knee, their knee's sore. So we'll come and we'll
Okay.
do 3 or 4 treatments on their left knee, and I'll call them up and I'll say, "Hey, Joe, how's your knee?" And they'll say, "Well, it's really weird. My knee feels great. Like it doesn't bother me at all. But now my right hip is sort of hurting. And it didn't hurt me at all before you came in." Okay, and I'll have to explain to them, well, here's the situation. Your knee pain was a volume 7. Your hip pain was a volume 4. We came in and we turned the volume down on that knee pain to a 1. And now all of a sudden you go, whoa, I have hip pain. I never had hip pain. You did. Your body just wasn't aware of it. It wasn't significant enough. So you will also notice this as well, that you are peeling the layers off of an onion. You're undoing some of the previous ancillary sort of injuries that have happened because of the primary problem.
Okay. Okay.
Okay, and it really just tells us where to go. So I'm just going to scroll back up just a little bit so we can go back over just the positioning and the 1, 2, and 3. Okay, because like the knee is key. Okay, you got this coil. Yes, you got 2 coils, the big one, and did you get this one with the Velcro?
No, I just got the small one coil, the big one, I guess.
Okay. I'm going to send you one that has the Velcro and the neoprene also. So you have that for the trial period, because it's a real nice tool to use for the knees. Okay. But what I wanted to show or make an example of using like this shoulder, you guys have experienced it, but a 1/4 of an inch with our machine is like a mile, right? If you put it on somebody's shoulder and they go, ooh, that's enough. If you bring it just even a 1/10 of an inch closer, they're going to jump out of the chair, right? It's too strong. Or you put it on the sciatic nerve area and they don't feel it, and you go just a 1/2 an inch closer towards the spine and they jump up because it hits that right nerve. So
Right.
with our machine, a 1/4 of an inch is dramatic. So why I'm saying that is I have heard what you have told me with the knee, especially knee replacement, quite a bit, and this is what I want you to encourage you to do. Until I send this Velcro sleeve out there, have the person, or if you have something that you can use, like a little wrap, compress the loop into the knee, so that way the entire loop is touching the entire knee, okay, as opposed to just resting it on there or resting it underneath.
Okay.
With our machine, that is dramatically different. Just making contact is different. Okay, there's a position, another thing that I'll have you guys try, called the praying position, and basically it illustrates the strength of the field and how it changes. If you put your hands in the middle of that big loop, you don't feel anything.
Right.
But if you fold that loop in half and then fold it over, so it's a bunch of small loops, and you put your
Right.
hands in the middle, like if you were playing, it feels like the pulse is shooting out both sides of your hands 2 feet. And you look, wait a minute, I didn't even touch the machine. I didn't adjust it. I didn't do anything. I just changed the field. And it's what we're doing is manipulating the field to be stronger or more effective. So like I said, once I send this coil out, it's going to be different for the knees. But in the short term, make sure for each spot they are compressing the loop into the area if they aren't feeling it or if they aren't getting results. Okay?
Okay.
So the knee lady, okay, and I'm just going to call her knee lady because I apologize, I forgot her name. We would have her do 1, 2, and 3 all at 2 minutes, so 2, 4, 6. We would do 4 positions on her knee: the front, the back, the left side, and the right side. So we're boxing the area. Okay, and so that 8 minutes plus 6 minutes doing the chest, crown, mid, back gives us 14 minutes. Okay, then I would go to the next areas. Like I believe you said she had a previous low back issue. So that gives us
Right.
now a good almost 12 to 15 minutes of treatment time where we could focus on the low back. So then I would do the low back. I would have her maybe sit on the loop, or however you have been using it to find it most effective for her.
Okay.
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 In this guide, in this manual that you're going to get, that I'm going to email, it has, if you will, the 1, 2, and 3 on quite a few common body parts. It has the knee. It has the Achilles, which works for the calf, so it will show the coil placement. It also shows where in the sleeve the coil is, so you know. Okay. Hips,
Okay.
thighs, groin. Okay. And so the real key is like this one where he's treating his thigh. This is a big loop. So if you're treating a broken finger in this loop, it's not going to be very effective. But putting it in this small sleeve, in the smaller loop, it's going to be more effective. So, like I said, I'm going to get this sleeve. I will get the other loop out there, so you guys have something else to play with as well, results wise.
Okay.
What we just covered, that 1, 2, and 3, generally covers most of the stuff that you're going to see. It's only going to be the fibromyalgia, chronic fatigue, Epstein-Barr, Guillain-Barré, MS, the disease, if you will, the disease states that we're going to have some specific protocols for you where I have a list that I email over. But the rest is body part based. Does it make sense what we've gone over?
Yes. Yeah, total sense. Actually, we were playing with a guy, not knowing with carpal tunnel, and he wasn't feeling anything in the wrist. That explains it. We didn't fold it up. We were just like, we were kind of amazed because, boy, sometimes you put it on some areas and it makes you just jump out of your seat. And we were like,
Totally.
you know what? How is this where you're not feeling it? And then we were putting our hand through it and we're going, yeah, I don't feel a thing here. What the hell? Okay, gotcha.
You were doing the right thing. I mean, really, the best thing. It sounds funny. I can't tell people this. The best thing would have been if I sent this to your house and you just used it on yourself and your family and played with it for a while. That is really the best thing. So that's the other thing I was going to encourage you to do is use it on yourself because there are some things after all these years I can't even describe. I still haven't been able to explain what you just explained to
Well,
me. I have
I'll
trouble
be.
explaining that
I
to
was
people.
kind of using
How do
it
I
on
describe that?
myself.
Right?
Yeah, I had, and that's one of the things I was doing, and I'll just give you some back on. I had I don't know, it was really weird. I had a stroke last June, and I lost
Yep.
vision, right field of vision. And I was kind of like, I was going to call you guys, and I just kind of kept doing it. And here's the deal: I was putting it on, and I felt it pretty strong on that right. It's the right eye and the
Yep.
right. I didn't know it was trigeminal, but it was going down my cheek, and I did have numbness in the cheek too at one time. But the weird part was, Josh, is and it may be connected. The more I look at it, that's when I got sick. I decided to see what this would do for my stroke, and man, last week I got
Yep.
like a sinus infection I never had before in my life. I mean, I
Yep.
had a history of sinus infections, but this like blitzed me. And I'm telling you, stuff was coming out that I told my wife it
Yep.
had to be there for
Yep.
years.
For years.
And
Yep.
the weird part is when I get a sinus infection, it'll last. It'll last 3, 4, sometimes I've had one that almost lasts the whole summer. This thing lasted 3 days. It knocked me out Memorial Day weekend. I was real tired this past week. I was in the office. But I have to tell you, man, everything just kind of
You feel
cleared
great.
out. And
Yep.
I'm going to say, is that from your, probably from the machine, because I've never experienced that before.
Yep.
Now, I don't know if that's associated with the stroke, because the stroke has been non-committal by neurologists. They see things, but they don't know why. They can't tell me anything. One even went as far and said, well, it could be your sinuses. I'm like, really? I stopped going to them because I wasn't getting real good answers. So what's your suggestion there?
So So we just crossed a bridge that I'm really glad we crossed, because if the first time I talk to somebody and I start to tell them all the things that I've seen and experienced in 15 years, I'm going to sound like I'm full of crap and it's snake oil and voodoo, and that's
Right.
the single biggest problem that I have with this machine. I've heard what you have just told me many times before, all in positive light. I hear this a lot. I hear this a lot with men where they pass stuff out of the urethra in the middle of the night. They say, I don't know what your machine did to me. I was up all night, but I passed something, and now I haven't felt this good in years. What's going on? This totally normal.
Okay.
This is what is expected. And let me dive to the patient and just for a second. So a fibromyalgia patient, 15 years of chronic pain, of meds, of immobility, right? They're going to be highly toxic. And what happens for them is maybe the third or fourth or fifth treatment. If they've had too much energy and they don't drink enough water, we'll wipe them out for 2 weeks. They'll feel flu-like, they'll feel achy, they'll feel sore like a workout. It's a Herxheimer's reaction. It's a healing crisis. Okay, and essentially what happens biologically. When you use the machine, it stimulates the cell gates, and this is the only thing that's found with high-powered pulse magnetic therapy. It's called electroporosis. Okay, the cell gates are stimulated; they open up and remain open for 2 to 3 hours after a session. How the body detoxifies? The only way the body detoxifies is the use of water. Water flows into the cells, dissolves the toxins, and then flows out. That's how we get toxins out of the cells. I know I'm using toxins very generally here in your case to say there's toxins there. It wasn't toxins. Something was there. The body went to work, dissolved it, and passed it out or pushed it out. We get guys with where we get good results are gall and kidney stones. We get really good results with that. It's not a magic bullet, but what it does is it helps the body pass them faster and smoother, so it's far less painful. My guess, and this is totally speculatory, is your body did something it needed to do. It needed to get rid of that stuff. If you start to run into with patients, and this is our barometer, this is how we know where we're at. They feel good, they feel energized, pain relief is good, they're still progressing, and then let's say they had 4 treatments in the week, and they call you on that Saturday and they go, whoa, I am wiped out today. I mean, I felt great using that machine for a while, but today I can't get out of bed. I don't feel sick. I am just run down. Like I can't go anywhere. That typically lets us know that they've had too much, and we back off. We put an extra day or 2 in between sessions. We make sure that the patients drink extra water after using the machine to flush their system out. The pro athletes, I've never experienced this with them because they're working out every day. They're exercising, they're sweating out. The opposite end, the fibromyalgia, I experience this a lot because their body isn't, they're rebuilding their body basically. So I know I'm being a little long-winded, but I just want to reassure you, not only this is normal, typically when this happens, I find it as a good sign because we're going to have a breakthrough. We're going to have a healing,
Right.
The body has sort of done something, and typically the person is better for the foreseeable future after something like this happens.
Right.
So
Well,
to me, it's good.
That one, I really believe
Yep.
that myself too.
Yeah.
Right.
I just want to go over this one last thing. I don't want to keep you guys too long too, but I do want to go over this one last thing because it is the way that we, if you will, introduce the patient the first time and convert them into a paying patient is totally different than treating them, because once they have paid for their session and we're treating them and they're in the room with you or with whoever's running the machine, the goal is let's get them better. Let's fix all their problems. Right? When we're introducing the machine, it's how do I, in 5 or 10 minutes, show this person that I have the most incredible piece of equipment in the world that's really going to help them, and they have no problem paying for it. That's essentially what this is. Okay, so I want to go over this one thing because it is totally different than it's the polar opposite of what we just talked about. Okay, typically when people get a machine, they'll ask us, well, how do you market it? Do I start getting print ads? Do I advertise? We have found the most success when you don't advertise, when you first start internally with the people that are walking in your front door. Okay, so we recommend that you put up some signage, ask us about a complimentary pain relief session, some sort of something to let them know to be verbal to ask you, because that way they are proactive. But every patient that comes back into the room, we simply do this. Hey, Mary. Hey, Fred. It's good to see you. We've got something new in the office we're trying. We want to see if you're a good candidate for it. When we're done today, Jen, Fred, Mary, whomever is going to come in and give you a 5-minute complimentary session, see if it works for you. Does that sound good? Everybody says yes because they like free pain relief. It's the darndest thing. So we just basically as a practice, you let them know, hey, we want to see if you're a good candidate. Okay, we bring the machine to them or them to the machine, and this is all we do. All the protocols, everything I just taught you, we throw out the window. Okay, we are looking to get it on their spot so they feel better. So you as the practitioner or the tech that you have running the machine, we know why Mary or Fred has been coming to us, mostly because they're back. They have a hip and they have this, but we choose their one bad spot, their hip, their neck, their back, the spot that you know that's going to respond. And we simply do a very short 5-minute demo session on that one spot. Don't worry about moving the loop and all the protocols and things like that. If it's a shoulder, we just put it on the shoulder. If it's a back, just put it on the back. We're looking for two simple things. We are looking for that aha moment where they go, wow, I feel it go right to the spot of my bad injury, which as you've experienced, you do. You feel it go right to your bad spot. And we want 5 minutes of treatment on that bad spot. So when it's done, Mary or Fred's going to stand up and they're going to have a tangible result. The range of motion one is the one I use all the time. It's fantastic. We're able to say, okay, look, we checked your range of motion on your shoulder before. We're doing it now. And after a 5-minute session, you got 50% change. That's pretty good. At that point, once we're able to show them something, then saying, okay, here's how we offer the therapy. It's $50 for one session or $45 for a 5-pack or $40 per session for a 10-pack. From that point, it sounds funny, but it ceases to become a sales situation, and now we're prescribing treatment, and they have no problem. Once they've experienced, with the point being, once they've experienced the machine and gotten a little bit of result, people typically don't have a hard time paying for it, and that's why we tell you to do the complimentary session first.
Okay. Now, Josh, in the scheme of like they come in for chiropractic and the billing, I just don't think I guess you're saying don't mix it. You take these people, put them on that machine so they know it's the machine.
Only for the demo. Just for the demo. Just for the demonstration. Just for the demonstration. Yeah, just for that 5 minutes. Because the billing that is your baby in that you figured out a good system to use. People pay cash; they have no problem paying cash. You can also utilize insurance billing as well. There's and the marriage of the two for that matter. And that part I definitely don't want to interfere. The only part I want to do is that complimentary session, that big deal of, hey, we're bringing you back here to try this on your bad spot. We don't want you to pay for it. We want to see if it's going to work for you.
Gotcha.
And in that 5 minutes, I know that it's great. It makes all the difference in the world. And I mean, I have docs that literally do not spend a cent on advertising for the first 3 or 4 years of using the machine, because just by doing this, they're beyond busy. They're packed to the brim.
Good. Well,
that's the goal. That's the goal.
Yeah. Okay. And I like it's kind of attended, but it's unattended. What would happen if my staff gets caught up and they leave it on a little too long? You're talking, that's the reaction you'll get. You might get some fatigue. You might get some the Herxheimer reaction.
That's the worst case scenario. That's a good question.
Right. Okay. Does it ever make the chief complaint, say, the hip pain worse? If you left it on too long, or if you did,
Sure. You don't. It's not worse. It's not that you feel worse. What you will feel if let's say the person fell asleep and they treated their hip for an hour, right, as opposed to 10 minutes.
Okay.
They may feel sore the next day, like they worked out. It's not going to exacerbate the situation where they go, wow, my pain was a 6 and now it's a 432. It's going to be like, whoa, I had a big workout yesterday. I feel sore in the area. It's almost tough to describe the sensations you have. It's not more of an acute pain. It's a muscle or general soreness in the area, almost like it got overworked.
Okay. Gotcha.
And that is the worst of the worst. I take that back. The worst of the worst is I saw somebody, my former business partner's nephew, fell asleep with it on his stomach after his bachelor party weekend, and he told us that he was literally in the bathroom for 3 days. And that was the most extreme that I've heard, where he said he was done to fall asleep. So that's a good thing. That's a good thing, right? That's the worst that can happen.
Yeah, I hear it. Yeah. One other question with that.
Yeah.
Go ahead.
No, I was just going to ask you if there's anything else that I can answer, anything we can cover.
Yeah. Okay, I had a couple, and then I just lost my train of thought with that one. Okay, first of all, in like, I don't know if you're familiar with Wally Schmidt and QA, quantum neurology or whatever, and a lot of scar treatments are huge, and it makes a huge difference just rubbing the scar. Is that in your protocol? Do you do that a lot? The scar treatment?
I would
have
Yep. Yep.
And that's
it's fantastic for scar tissue.
2 minutes?
2 minutes of boxing the area. So 2 minutes on each spot. So anterior, posterior, front, or to the side. And you said something I should point out. We have found over the years, this is anecdotal, obviously we're not going to be able to do a study, but feedback from practitioners that utilizing the machine while they're doing their other therapies has been really effective. Massage, and utilizing the machine where they put it on somebody's back and utilizing it that way, or they'll do an adjustment and then do the machine right after to make the adjustment hold longer. Things like that, or oxygen or nutrition. Just combining the two seems to be real harmonious. You mentioned quantum, so I'm just going to say this. I have found that the machine is like the yin, and the rest of the therapies are the yang. It is the masculine and the feminine energy, and the machine is the masculine that drives the feminine energy in. And the marriage of the two are really incredible.
I got a patient who has deep venous thrombosis. I mean, real bad.
Yep.
She, part of her holding her up, we're doing well, but she, it's so like it keeps her from exercising. No problem with putting that on her leg.
No problem. Do it right away. I will tell you, I hate to just be full of stories, but you've been around long enough, you have them. We went to Australia when I was 6 months pregnant, when my wife was 6 months pregnant, and the doctor was like, well, probably it's going to be okay. It was debatable. We went, and we shouldn't have, as it was. She got off the plane, and it was not a good situation. Her ankles were like the size of my neck. She had clearly had the beginnings, if you will, of it was more than just DVT because she's pregnant. They're worried about her kidney issue and all that. We rushed her to where our distributor's office was in Australia, and I gave her like a 30-minute treatment, and she woke up the next morning, and it was like there was nothing wrong. I mean, if you could have seen the difference in her ankles, it was 60-75% reduction in 8 or 9 hours. So just the fact that we were able to do that after a long flight, we know that we're working on the circulatory system really fast. So it should be that. I mean, I would be surprised if after 3 or 4 sessions, if this person didn't have a pretty fantastic result.
All right. And so anyway, that kind of answers, because I have another guy with the heart thing. He has stents in the heart. No problem.
Stents are okay. No problem. No problem. Pacemakers or electrical implants are the only ones that we can't use.
Could see that. Is there any nutrition that enhances results?
Yeah. Essentially, it really just depends on what you're looking for in the body. Okay, but I'll give you an example. People that are using electrolytes, they get an awesome result because the electrolytes are magnetically sensitive, right? They're elements that respond to electromagnetic energy. But B, there is a direct and measurable result when we put more sodium or more potassium into the body, or more magnesium, for example. I'll give you, again, a simple one. People that are having problems sleeping, people that are having leg cramps, and they'll tell you, well, I'm already on magnesium. the second you bring in the machine, it's like a life changer, because it takes that magnesium that's only getting absorbed X%, and now all of a sudden the cell's getting 30 to 40% of it more immediately. So it works. The first night they'll say, "Well, I don't know what you did, but I slept all night." And for somebody that can't sleep, and even if they're taking magnesium, that's traumatic. So I know I'm giving a general answer, but it's essentially it's whatever your goal is, you utilize the nutrition, and you're going to get a better result.
Okay. Any suggestion on what electrolyte product you prefer? You guys been working with it?
There's I'll have to get the name. I use there's a liquid potassium magnesium. I forget the name of it. There's a place called Follow Your Heart out here, but that's like a small local chain. I have to find who makes it. But
Okay.
anything,
I mean,
personal experience, anything liquid is best.
Yeah. Okay, great.
Um,
Last one.
yeah.
Now, I know I was watching, and I was told by Jack at one time that when he was telling me that I could use this diagnostically. So with that introduction patient, I'm assuming I could get the ring and go around, and wherever it's strongest in the area of pain is where I should put it on. That's kind of where the diagnosis would be. Is that accurate?
Yep, it's accurate. And just further to that,
go ahead.
I just want to tell you, like with back injury, okay, this is where we see it a lot. Patient has been coming in with low back pain for years, but we take the loop and put it on the low back, and it is nowhere near as intense as when we put it on the upper left hip. Right, we put it on the low back, and they say, "Yeah, okay, I feel it, it's strong." And then we put it on the upper left hip, and they get that look, the look of, "Oh my goodness," and they feel it in their left hip and their low back. A lot of the times, it'll tell us, "Okay, it's not just the low back; it's the left hip that's radiating the low back, or something else."
Okay.
So,
and
so
you would treat that left
basically,
hip 5 minutes. You would just treat that left hip to get the wow factor.
Yes.
Okay. Good, because I was going to say, this guy with the hip problem, I think he also, which I know when we just were sending him out for an MRI, that he has, I'm almost sure he has an L2, L3 involvement. Whether it's a herniated disc or whether it's a stenotic situation. I know he has it, and I'm going to run that field over and see which one reacts the most, and then we'll see where he goes with that. Okay. Great.
That sounds good. That makes sense.
All right. Fantastic, man. I'm glad. I wish I would have done this earlier, but I'm glad we got this going, and I'm going to get on it actually today. Very good.
That sounds great. And questions, anything that comes up, call, text, write, send smoke signals from the mountain, whatever you need to get our attention.
Hey, is your cell phone number, John?
Yeah, let me give you my cell phone. Okay? It's area code 805 341 4902.
4902. All right, great.
And you can text me also. I respond to text messages. Any of that stuff, you can always reach me.
I'll probably, the text is great. Okay, fantastic, Josh. Appreciate it.
Yep, thanks for all the time. And like I said, I will email the recording to you and also some follow-up documents to help get you guys going. Thank you guys for all the time.
Okay, and you'll send me out that little knee thing?
Yes. Yep, we'll send that out to you this week also.
Okay, great. All right, great. Thanks, Josh.
Thanks, Gary. Have a good one, man. We'll talk to you soon.
Sounds good. Bye-bye.